take it to the final step, right?
I did. I mean, I knew that I would never want to have gastric bypass, but I got to the point where I had lost about 120 pounds, and even though I knew that it was a lot of weight loss, I had all this excess skin that was really interfering a lot, and it was really, I couldn't really see the significance of my weight loss because I was so disproportionate in my abdomen area.
Dr. Lucy Capek is the one who did the plastic surgery. Dr. Capek, it's good to talk to you about this process as well.
Happy to be here.
So she had a couple of surgeries.
Correct.
And you've done probably many of these where people have lost a lot of weight. Can you walk us through that a little bit?
Sure. This has become a much more common series of procedures as we see patients losing weight, which is great to see that many people are getting healthier and exercising, dieting, and even having weight loss surgery procedures, as in gastric bypass and so on. But this patient population now is very common, and what happens is patients lose a great deal of weight, in most cases over 50 pounds, and many cases over 100. And you can imagine that as the weight comes off, they're left with many areas with loose skin. And although they are feeling better and feeling much healthier, these excess skin issues can become a real problem for them as they continue to lose weight.
Now, I was wondering about that, if this would be considered purely cosmetic or if there are some definite medical needs to take care of the excess skin.
I would say in the majority of cases it is considered a cosmetic problem, certainly from the point of view of the insurance companies, because in many cases it really doesn't cause medical problems per se. In a limited number of patients, the skin excess can be so severe that patients have rashes or even breakdown and wounds in the folds of the skin, in which case now it becomes medically necessary to treat it. So again, the vast majority of patients, it really is considered more of a cosmetic improvement. In Melissa's case, she was having some issues that made it, at least parts of the procedure, a medically necessary one.
And I would think then, of course, there are bigger issues beyond that. If you've gone through all of this, you've lost all that weight, this, I think, must feel like the final step you have to take.
Absolutely. This is something that is really life-changing for patients. And what I find is I see patients come in who've done all this hard work, losing an enormous amount of weight. And again, they're healthier, their blood pressure has normalized, their diabetes has gone away, they feel really good in one sense, but they're having a lot of self-esteem issues because the excess skin is still impacting so tremendously on how their clothes fit, how they feel about themselves, that now you've got an entire emotional aspect that is very frustrating for them. So they feel that they've worked so hard and yet they're kind of stuck with all this excess skin that they just can't get rid of.
And I'm sure it's still a little bit of a dilemma because surgery is surgery.
Absolutely. It's surgery, but I will say most of these patients, when they get to that point, they're very, very motivated to take the next step. I think what is frustrating for some of them is that, again, from the point of view of the insurance companies, many of these procedures are not considered medically necessary, and for many patients that is a big problem because obviously to have to pay for it yourself, it's very costly and not everyone can do it.
And in some cases maybe more than one surgery is required for different areas of the body.
Absolutely. In many cases, to try to do everything in one session would be potentially too risky, particularly in a patient where we're talking treating upper and lower limbs, so arms, legs, as well as the trunk and even the breasts. It can be a little too much to do in one session in many cases, and so, yes, they may be looking at multiple procedures.
And so, but this is something that you've done with many people.
Yes, absolutely. And as I say, it's an increasing population. I think I'm certainly seeing more patients over the years with these issues.
Can you tell me a little bit more about how they feel and how they respond to this before and after?
Well, the patients come in, as I said, often very frustrated and highly motivated to have something done. And what I'm always amazed at is how life-changing patients say it is. In fact, it often seems to exceed their expectations in terms of how much of an impact it has on their life. That was certainly the case with Melissa. I think what's so interesting to me is when she first came in, she had fairly modest goals. She was really looking just to have excess skin removed from her abdomen because it impacted how easily she could exercise. It was just in her way. But she really didn't have major cosmetic motivations. It was functional. This was just something that she had sort of reached a plateau in her exercise program because this was in her way. And once that first procedure was done, she told me that it really changed how she looked at herself and made her much more confident, but at the same time, it made her realize she wanted to take things even further. So it's quite inspiring, really, to work with these patients because, as I said, it's tremendous to see all the work they put in, and then the surgery that I do, how much it impacts their life is tremendously gratifying for me.
I appreciate you spending some time with us, Dr. Lucy Capek, plastic surgeon. Thanks so much, and thank you for joining us on Clearview.
Thank you very much for having me.
It's Chuck and